So this research really started with the idea that local authorities, housing associations and health ought to be natural partners. There is so much crossover with the people that they deal with, their residents and customers, that there ought to be significant advantages from bringing services together and collaborating to a much greater extent. Now, we do know that often together and individually as well, each of the sectors delivers a really broad range of services to help people across a huge range of areas. So things like income and employment, around health and well-being, social care services. There's a lot that's already happening out there. But given the contextual challenges at the moment, so welfare reforms, the need to make significant savings, but also changing demographics, so we have an ageing population, many of whom will have complex needs, there is a real benefit in bringing together all of these services and making them much more holistic and cross-cutting, but also delivering benefits for partners from doing this. So things like being able to save money, deliver better outcomes for people. So the research really started with the idea that there are huge opportunities in pursuing a much more collaborative approach. What might be the routes to doing this, and are there any barriers in the way that's stopping places from getting on and collaborating? Through our research, our key findings were that there is already a lot of partnership working that is happening between sectors, so between local authorities, housing associations and health, and this is really encouraging. More often than not, this tends to be about delivering outcomes in housing and local facilities, so things that you might deem the more basic partnerships between the sectors around development, around housing management. And that's really encouraging. And then there are also some services starting to emerge in other areas, more holistic areas, across things like health and well-being and income and financial inclusion. But at the same time, we also got a sense from our interviews and from our workshop that partnerships were perhaps not as developed as once thought. That where issues have been identified, the tendency is for sectors to want to try and deal with it themselves rather than seek partnerships as a first point of call. That where partnerships are in place, they tend to be more contractual, so more about a commissioning and provider relationship rather than one that's much more of equals, where each partner has an equal say in priorities, contributes funding. So that there was a kind of a difference between those sort of partnerships and ones that are perhaps much more collaborative. But then we also found that there was a real perception, sometimes wrongly, but a real perception of different cultural differences across sectors, different priorities, things that can make collaboration often quite difficult. So our survey showed that local authorities tend to want to focus on people who have issues that are more around health and well-being outcomes, whereas housing associations want to deal with people and develop services that are more around income and financial inclusion. And that's really understandable because what they're doing is focusing on the areas where it's going to have perhaps the biggest impact, both financially and in terms of outcomes. And that's really understandable, but it does question how collaboration can really flourish in an environment where there's perceptions of different priorities. But then we also found that there were a series of quite on-the-ground and practical barriers that can get in the way of organisations collaborating and embedding collaboration to a much greater extent. And that tends to be things around finance, so lack of finance or difficulty in bringing together finance and other resources to make collaboration happen. That often there's such a big difference between the priorities of local authorities and housing associations. They're all so different that starting from scratch with different organisations every time you want to collaborate can be really difficult. And then there isn't really an understanding in all places of what those priorities are. And then there's other issues around geographical coterminosity, so different organisations not having the same geographical boundaries, which can make collaboration difficult. And then other things like speaking the same language. All of those things can often make collaboration quite difficult. Well, in terms of the future, there are huge opportunities in housing associations, local authorities and health pursuing more of a collaborative approach to working. So applying things like the threads of troubled families, we think can deliver really good outcomes for people, but also start to deliver quite significant savings to the organisations involved. So we do think there are huge opportunities ahead. Through our research, we've also found and looked at a series of case studies that really do demonstrate the benefits of working together. So, for example, when we look at things like the Pembury Pass, they're already starting to see really good outcomes for young people in terms of employment. And so we feel that that kind of model, bringing together services at a neighbourhood level, integrating them and working together, we think that kind of model could be replicable elsewhere. And so in order to encourage more partnership working, more collaboration, and to get over some of those barriers that I talked about earlier, we've developed a series of tools. Now these are all really practical, some of them quite easy things to do, some of them less so, but very practical nonetheless, that can help places to break through some of those issues that can often make collaboration difficult. Now, in order to start implementing those tools, and we do think that those tools can be used by everyone if they want to start doing more collaboration, in order to implement those tools, we've made 5 broad recommendations through this research. So the first one is that local authorities should develop cross-departmental working groups that bring in partners where they can talk about collaboration, they can look at innovation and really think through what the benefits of collaboration might be for all partners involved. We also suggest that hack days might be a really good way of starting to look at designing services from the bottom up in a collaborative way to focus on the user and start thinking through how they can be brought together. We also recommend that in areas where collaboration has been working well, some housing associations have appointed a specific officer to lead on partnership working. We recommend that that's a useful thing to do where housing associations want to do more collaboration. We also think there's a real value in bringing together and sharing data to a much greater extent on all issues within the community. So bring together the information from health and from local authorities that we already know that is collected through the Joint Strategic Needs Assessment, and then bring that with all of the data that housing associations have on their tenants, on the issues in their local areas, and build up a really rich picture of what the issues are in an area and then think through how they might go about tackling them. And then the final recommendation we make is to government really. We think there's a big role for government in supporting and enabling change, transformational change through services and service collaboration. So we suggest that government should take forward some of the recommendations that have been outlined in the Bolder, Braver, Better report from the Service Transformation Challenge panel. So if I was looking back in 10 years and I was thinking about the difference this research had made, I would really like to think that more partners look to developing collaborative services as a first point of call rather than as a second thought. I really do think there are huge opportunities through bringing together services, integrating them, because ultimately I do think that will deliver better outcomes for residents themselves.